Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
functional classification of catecholamines. So these includes number one, cardiostimulants. Adrenergic drugs which are cardiostimulants are adrenaline, noradrenaline, dopamine, dobutamine and isoproterenol are the cardiostimulants. Then vasopressors, adrenergic drugs which are vasopressors are we have adrenaline, noradrenaline, ephedrine, phenylephrine. Then we have methoxamine which is an alpha agonist, and we have mephenteramine and midodrine. So these are the vasopressors which are adrenergic drugs. Adrenergic drugs which are used as nasal decongestants include we have nafazolin, then we have ephedrine, then we have xylometazoline which are nasal decongestants. Then we also have pseudoephedrine which are the nasal decongestants. Nasal decongestants are nafazolin, xylometazoline, ephedrine, pseudoephedrine and phenylpropanolamine. The thing is, this phenylpropanolamine is banned because it can cause hemorrhagic stroke. Because it causes hemorrhagic stroke, this phenylpropanolamine is banned. Then we also have anorectics. The adrenergic drugs which are anorectics include we have methamphetamine, then sibutramine, fenfluramine, orlistat, rimonabant, mazindol, topiramate is present, and also modafinil. So anorectics which are adrenergic drugs which are anorectics are methamphetamine, sibutramine, fenfluramine, orlistat, rimonabant, mazindol, topiramate and modafinil. Then adrenergic drugs which are used in postural hypotension. For postural hypotension we have ephedrine, midodrine and droxydropa are the drugs which are used for postural hypotension. Then uterine relaxants are also called as tocolytics. These uterine relaxants include isoxaprine, then we have ritodrine. So these are the uterine relaxants. Other tocolytics which are not adrenergic drugs are magnesium sulfate, progesterone, ethanol, calcium channel blockers, then etosiban and also vilatamate. So these are uterine relaxants or tocolytics. Isoxaprine and also ritodrine are also the uterine relaxants which are adrenergic drugs. Then CNS stimulants. CNS stimulants are methylphenidate. This methylphenidate is used as a drug of choice for attention deficit hyperactivity disorder, and we have atomoxetine. Atomoxetine is the can also be used. Then we have modafinil. Modafinil is the drug of choice for narcolepsy, and this is also used for obstructive sleep apnea. Then we also have one more adrenergic drug which is depivefrin. This depivefrin is actually a pro-drug of epinephrine. This depivefrin, which is a pro-drug of epinephrine, it is used in glaucoma and it will increase the aqueous humor. It increases the aqueous humor outflow and thus decreases the production of aqueous humor, and it can be used as a pro-drug in depivefrin.
thank you and thank you for watching.